basically, I got a tooth abscess. If y'all get a cracked tooth or infected tooth, or if your teeth get impacted, go to the dentist immediately. Like, I guess I was prolonging that shit too long to the point this shit happened.
Why did you wait so long? I'm a board certified dentist in case you don't know who I am. I've been practicing for over 12 years. I have never seen an abscess this big in my entire life. This thing is huge, and it looks like he ended up in the ER because of it, which is the right place for him to be. He should be in the ER because an abscess that big that is growing down close to your neck and your airway, once it gets down into your airway, you can't breathe, and it could be life or death for you. How do you avoid this from happening? Number one is go to your dentist regularly. Don't delay things.
Yeah. Go to the dentist immediately.
You know, like when you go into your dentist and we take like a million x-rays, there's only 18 that we take, but what we're looking for is little localized abscesses that you don't feel on those x-rays. That is why we take those x-rays, and that's why it's so important to go to your dentist regularly. Look, a dental abscess is caused by a localized infection. So something causes a tooth, usually it's only one tooth, and when it becomes infected, it's got a little circle on the end of the root. That is called a localized abscess. Sometimes you can feel those, most of the times you cannot. It just means that the tooth has died. The nerve has basically died and become infected. That infection can either stay dormant for a number of years, or it can become swollen and inflame your face and look like this guy in this video. And the way to avoid this is to see your dentist regularly too. If you do have a dental abscess, the treatment is either pull the tooth or root canal the tooth. If we root canal the tooth, it's going to stop that infection dead in its tracks. And yes, I said the word root canal. Nobody likes that word and everybody's scared of it for some reason. But I mean, you sitting at home, would you rather have a root canal or end up in the ER with this swollen tooth, which you could end up needing a root canal on it or pull the tooth anyways? I would much rather have a root canal and just sidestep all of this pain and swelling. The biggest thing is that your tooth looks like this. It's dark. This tooth is really dark. It has died. The lights have just, and that tooth dying is a first indication that you could have a swollen abscess like this guy did in this video. So go to the dentist and get that checked out. If you have a dead tooth, go get it checked out. If you think you have a dead tooth, get it checked out. How can you tell at home if you have this happening to you? Sometimes if your tooth is dead and you have a localized abscess that could turn into swelling like this guy, you could have the tooth hurting when you're biting down. So if you've ever been chewing your food, all of a sudden one tooth, it's usually these back molars, feels like it just hurts every time you bite. You bite down and it's sensitive. That could mean that you have a dental abscess on that tooth. So again, go get it checked out. I feel like I'm repeating myself over and over, but go get it checked out by your dentist. Another thing is sometimes people can feel on the sides of their gums if there's a little like swelling. Some people say it feels like a little pimple, or even underneath here. Sometimes you can feel your lymph nodes and you can actually feel that your lymph nodes are enlarged. Enlarged lymph nodes right underneath here in your jaw indicate that there is an infection somewhere that your body is fighting. So if you feel a little bit of infection here and it's been there for like 2, 3, 4, 5 days, and you have a little pimple or a little bump or swelling on the end of the root of your tooth, it could be the start of a dental abscess. So, and I do not want to repeat it again, go to your dentist and get it checked out. Another way people find out that they have dental abscesses is because they have a sinus infection that doesn't get cleared up by any other doctor. You've seen doctor after doctor. You've seen a ENT, which stands for ear, nose, and throat. You go to your ENT and they can't find anything wrong with you. You have a swollen face. You've got a sinus infection on one side and not the other. That could be because teeth cause sinus infections. Some ENTs will not refer you back to your dentist, which is a shame because dentists find these things all the time, where I've seen sinuses that are fully inflamed and somebody has a big, massive sinus infection, and sometimes they've had it for years because they have an infected tooth and that's leaking up into the sinus. The source of the infection is not going to be cleared up by antibiotics. Antibiotics will only help you for a few days, maybe a few weeks, but then it's going to come back again because the source of the infection is the tooth. And by going to the dentist, you can get that solved and you can get that fixed because a dentist is going to know what to look for. In an ENT, sometimes they refer you back to the dentist. Sometimes they just say, I don't see anything on the x-ray. Here's some antibiotics. Here's some anti-inflammatory. Here's some steroids that you can use. And the infection never goes away because it's caused by a tooth. All right, that's all I have for this video. Hopefully you have learned a ton about dentistry and about teeth, and most importantly, how to avoid ending up going into the ER like this poor guy did. And even he says himself, go to the dentist and don't linger. So I'm guessing that he's had this tooth like lingering in pain, or it's probably been like slightly swollen for a while until all of a sudden, boom. And when this happens, it happens fast. When you have an infection and it swells up, those abscesses, they explode. They explode really, really big, really fast. And it is an emergency situation. And sometimes the only place that is open is the ER and not your dentist's office, where a lot of times in the ER, they just don't even know what to do. They'll drain it, they'll put you on antibiotics, but they're going to refer you back to the dentist anyways. So go to the dentist in the first place. Avoid this. If you've had a dental abscess or this has been you and you ended up in the ER, let me know your experience. I do read these comments. Just kind of type down here on your little keyboard and write a little bit about your experience, because I always like learning about people's experiences. But as a patient, this must be a very frightening experience. So I hope you guys like this video and thank you for watching.